Afternoon.
Hello. How's everybody doing?
Good. How are you doing?
Wonderful. So glad to be here.
Yep, indeed.
And looks like we have our quorum, so that's always a positive so that we can get started on time. I want to make sure the Department of Health, I think they said they lost their Zoom capability there for a moment.
We're back.
You're back. Oh, there you are.
I didn't recognize the room without all of its boxes in it.
Oh
That's
my
so funny.
gosh.
I was thinking the exact same thing.
Look at that.
It's all
It
cleared
looks like
out.
Bob took that over as an executive office suite. Look at that. One desk in there.
Laid them all out today, almost all of them. If you look at the side over here, we've got a few left, but
Wow.
getting better.
Looks nice.
Wow, wow, wow.
Nobody's sitting over there. I think they're going over there at the table.
We're at 4:29, so we'll give folks just a minute or two more, and then we will call this meeting to order.
Hi, Heidi. Amy Murray is on the line.
Hi, Amy Murray. Good to see you. Good to hear you.
Thank you. You as well.
Thanks for being here.
You're welcome.
Hey, Amy, since we're chatting here, we've got about probably a minute more. So I know you are out of town this week. You were using an acronym. What does that acronym stand for?
You said that I'm using an acronym?
Yeah.
You know what? I'm going to push pause and I'll text you. No problem.
Sure.
Yeah.
I'll watch for it.
Yep.
It's going to be tough. I'm going to want to put a button near them. Is it going to be that hard?
I'm thinking it's going to
Oh,
be.
from there?
Yeah, from there.
Okay.
But if there are questions, they'll probably come to me.
Oh, so are you sitting right there?
Yeah, I'm sitting
So I have my,
here. Again, I may not have much to say, but you're welcome to put mic. Yeah.
if we don't get a sound bite, it's okay. Please share the information. Perfect. Thanks. You guys have been busy during this pandemic.
It's been, unfortunately, a little bit busier than we would like.
Hey, Department of Health, is Mr. Keckley in the room? I just want to make sure before we call. Okay, great. Just before we get the call the meeting to order. So we are at 4:31 and we're going to call this meeting to order. We have a quorum. We're going to start things just a little bit differently this time around. I am going to call off the board members' names and they will respond with here or present. And then I will ask all of the Department of Health staff to introduce themselves. And then for the guests and the media, I would like you to please document your name, your address, and your affiliation, if applicable, in the chat box. Further, if you wish to speak during the public comment segment, please indicate in the chat box by documenting the words public comment, and then I will invite the public to speak in the order in which they appear. So please go ahead and populate that chat box. But in the meantime, I'm going to take the roll call for the board members, and I'm going to do it according to where you guys show up on the screen. Jason Marker.
Present.
Michelle Migliori.
Present.
Ilana Kirsch.
Present.
Emily Dean.
Present.
That would represent the 5 of us. Amy Murray.
Present.
Thank you. John Lynn. John Lynn is not on the call. The Department of Health staff, well, let's start with the office, the conference office there. If everybody would introduce themselves, who's in the office.
Yeah. Hi, Heidi. Bob Einchers, Health Officer.
Malcolm Lang, Department of Health intern.
Jennifer Parcell, Executive Administrative Assistant.
Dave Keckley, attorney for the health officer and the Board of Health.
And also in this room is Monica Murphy, channel 57? 16. Okay, there we go.
Wonderful. And then I'm seeing other Department of Health staff, Brett Davis, Carolyn Smith. Am I missing any other Department of Health staff?
Robin Vita.
Robin Vita. Hello, Robin Vita. Welcome.
Hi, guys. Thank you.
And just as a reminder, if you've just come on and you are a guest or the media, please sign into the chat box with your name, your address, and affiliation if that is applicable. And if you would like to speak during the public comment section, please add the words public comment, and then we will call on you during the public comment section segment. Moving on to
Mark Fox, Department of Health, also here.
Hi, Mark Fox. Welcome. Thank you for being here.
And John Lynn has arrived.
John Lynn is here, yes. Well, hello.
Hello, John. Welcome. All right. We are now all accounted for. We got a full house. Awesome. So let's move on to agenda item number 2, the adoption of the agenda. It is recommended that the Board of Health members adopt this agenda for the July 15th, 2020 meeting. Motion?
So moved. I'll second it.
Thank you. For all those, if there are any discussion regarding the adoption of the agenda, we'll move to a vote. All those in favor, say aye.
Aye.
Aye. Any opposed? The ayes have it. We have adopted the agenda. Moving on to number 3, this is approval of the meeting minutes that was included in your board packet. It's recommended the Board of Health members approve the minutes of June 17th, 2020. May I have a motion?
So moved.
Second?
Second.
Thank you. Are there any discussions regarding the minutes that were included in your packet? There are no discussion items, then I would call for the vote. For all those in favor, say aye.
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 All those opposed, say nay.
Nay. I'm sorry.
That's all right. That's all right. The ayes have it. We have approved the minutes. Moving on to agenda number 4, this is the board president announcement. I just had one very short story that I wanted to share with you. At Beacon Health, physicians who bring their best each day are recognized with a Rockin' Doc Award. Typically, this recognition is given to Beacon Health System physicians, but Memorial Hospital surprised 2 doctors outside of their organization by honoring them with this award during a meeting this past week. Our very own Dr. Bob Einters and Dr. Mark Fox were both recognized as Rockin' Docs last week. Beacon made the following statement. Dr. Einters and Dr. Fox have played pivotal roles in organizing, preparing, and dealing with the COVID-19 pandemic throughout our county. To thank them for their hard work, Memorial Hospital leadership presented each of them with a Memorial Challenge coin and a Rockin' Doc pin. Thank you, Dr. Einters and Dr. Fox, for your support. The board would like to thank Beacon for this recognition, and then of course add our thanks to Dr. Einters and Fox and the entire Department of Health staff for all the work that they're doing to fight this virus. That concludes.
Yay. Nice job.
Congratulations.
That was awesome.
Bravo.
So moving on to agenda number 5, this is the health officer's presentation report, and now I will turn it over to Dr. Einters.
Thank you, Heidi, and thank you for the acknowledgement. I'll be very brief in this report. You've all received, or should have received, a copy of the report, and not surprisingly, the month of June was comprised predominantly of responding to the COVID epidemic. But that said, the other business of the Department of Health continued unabated. There is nothing particularly outstanding. They are all outstanding, but in terms of what's in the report, nothing particularly notable or outstanding. It's business as usual. I'll point out just one, which is that at the environmental health, who will be giving a presentation today a little bit later by Brett Davis, did on their own initiative seek out some additional funding and aim to ramp up their vector control program. And though not noted in the notes here because it happened in July, we did discover West Nile virus here, not surprisingly, but they did do that very early in the season. We're not able to alert the community to that danger yet again. Otherwise, I'll be happy to respond to any questions, but I know our agenda is pretty full with other matters. Simply would respond to those questions, but also wish again to acknowledge the hard work of all of our units in the face of the pandemic, yet continuing to do the work that needs to be done to keep our community safe. So happy to respond to any questions you may have.
Thank you, Dr. Einters. Do any board members have questions at this time? By that silence, I will think that we don't have any questions at this time. So thank you very much, Dr. Einters, for your report. And so now we'll move on to agenda item number 6 for the Deputy Health Officer presentation. And Dr. Fox, we will turn it over to you.
All right, I also will keep this relatively brief. In your packet is the latest data summary that was done. I think that was July 2nd, presented at the press conference with the mayor and commissioner and Jeff Ray. And, you know, through the month of June, I guess in retrospect, it was a little bit of a lull for us as we gear up, and a lot of our efforts were focused on working with both universities and K through 12 schools in the area. Everything from, you know, graduation plans to return to school plans. We've continued to work, obviously, in unified command with health system partners, Beacon, St. Joe, and South Bend Clinic, as well as Jeff Ray as the liaison to elected officials and the business community. As part of that work, in addition to our work with schools, we were developing plans for opportunities created by some of the CARES Act money that's been received by the county. Those include, you know, laying the foundations for opening 2 new testing sites, which have opened in the last 2 weeks. One opened last week at St. Adalbert's and the other this week at the radio station WUBS. So those are both operational and pretty busy already. So we've seen, you know, still a considerable need for testing, but our goal was to reach those communities in need in particular. And then, you know, just to moving beyond the month of June a little bit here, and even in the 10 days or so following the holiday weekend for 4th of July, we've seen a pretty significant increase in number of cases. We actually are, one of the metrics that we calculate is the average number of new cases each day over a rolling 7-day period. And we currently are averaging more than 39.5 cases per day, which is higher than we have seen at any point in the pandemic. So in the first part of April, we had a stretch where we were in about the mid-30s at about 36 cases per day on our 7-day rolling average. So now we're almost to 40. We've also introduced a new metric that actually is out in the press release today, really for the first time as part of our public release, and that's a number of active cases. So that reflects the number of cases confirmed over the prior 2 weeks. So that would reflect kind of the period of time when people are, obviously some people may be sicker longer, but that's a reasonable surrogate for a period of time when people are infectious and therefore kind of deemed to be active cases. And so that number at 436 also is the highest number that we've calculated it throughout the pandemic, but have not reported on it. But that's the highest number that we've seen as well. So, we certainly have seen a significant increase in the confirmed number of cases in the county in this period since the 4th of July. And while, yes, there's increased testing, additionally, our positivity rate is increasing. And so that gives us concern for being headed in the wrong direction. So we still need to reinforce the importance of mitigation strategies. So I'll stop there, and obviously we'd be happy to answer any questions from the board.
Thanks, Mark. Jason?
Dr. Fox, in the older demographic, age 65 and up, are half of those cases still in extended care facility settings, or are more of those this month beginning to show up in the general community setting?
Yeah, there have not been significant numbers of cases in long-term care facilities here in the last few weeks. So it much more is community transmission that we're seeing in that population at this point.
Thank you.
Dr. Fox, I have a question about the testing sites, testing criteria. Have we started to include those who have no symptoms?
So at the Optum site, and then also, the State Department of Health has their strike team working out of Northside Gymnasium in Elkhart. My understanding is at both of those locations, anyone can be tested, irrespective of symptoms. We have for a long time really left it up to the discretion of the clinician, and have had a pretty low bar for being able to access testing. But we don't have a specific mandate to throw the doors wide open. And interestingly, it's important for the board to know that recently, within the last couple of weeks, CMS, the Centers for Medicare and Medicaid Services, has said they will no longer reimburse for kind of blanket surveillance testing for like return to work or return to school or things like that, that any test that they will reimburse has to be an individualized decision about a specific patient. I'm not entirely sure how they'll assess that last piece, but it was kind of put out there as best we can tell as a way to say, we're not going to test every kid, as a blanket for returning to school or something like that. And I know many universities are doing that as a condition for entering their residence halls, which may be a special consideration. But I know there's been some discussion for K through 12 schools as well. And Dr. Box has really dissuaded people to pursue that line of reasoning in large part because of this restriction from the Centers for Medicare and Medicaid Services. Having said that, if an individual contacts any of the COVID hotlines and articulates, a reason they need to be tested, I think by and large the clinician discretion is to facilitate access to testing rather than introducing barriers.
Lana, Dr. Kirsch, I believe you had your hand up.
I just wanted to clarify something that I thought that I heard you mention, Mark, and that was, did you say that the numbers in the county now are the highest that they've been since the beginning of this pandemic?
Yes, that's correct.
Continuing to increase.
Yes.
Okay.
We had dropped during, the month of June down to, low teens, mostly 12 to 16 new cases per day. With the transition to stage 4, and then most pronounced following the transition to stage 4.5, we've seen those numbers blossom from low to mid-teens now to the high 30s. And that's new cases per day among St. Joseph County residents.
I just wanted to add a comment to that late breaking, I think around 2:30 this afternoon or something like that. Isn't it that Governor Holcomb has now extended stage 4.5 in recognition of the fact that Indiana's we're in the midst of an increase. And so that's the state's recognition that we're trending in the wrong direction.
Although it feels like it's kind of stage 4.75 because he is allowing gatherings greater than 250 based on review by the local health department. So any graduation, any concert, any festival type thing will require review at the local level, which wasn't communicated to the local officials until after the press conference. We've already been working with the schools on graduation plans and return to school plans, so that's not necessarily a change, but so we did go from a restriction to 250 now to allowing more than that once a plan has been vetted by the local health department.
Wow. Jason, Dr. Marker, you had a question.
Yes, Dr. Fox, a couple of follow-up questions about some of the data that's presented here, thinking about the racial inequities that have been seen around the country regarding COVID-19. It looks like from the data that's presented here that we've got about 24% African-American population in our county, which is then 30% of the fatalities in our county. Now, that is a notable difference, about 20% altogether difference based on that population group itself. And I'm curious if that is changing over time, if we're catching up to some parity in how we're testing and managing the racial differences in our community. Perhaps more notably, our Hispanic population in St. Joseph County, which represents 28% of the county, only accounts for 3% of the fatalities. And wondering if you have any thoughts about how we're trending over time and making sure that we are reaching into all the communities that we need to, and why the stark difference in the Hispanic population between their representation and their fatality rate.
Yeah, no, those are great questions, and those numbers have shifted somewhat over time. Through most of the pandemic, whites represented about half of the confirmed cases, while representing a significantly great, and that's white, not of Hispanic origin, how we divide that out. Though we don't represent that, whites don't represent that proportion of the general population. There was a period of time where the Hispanic community represented more than a third of confirmed cases. So it's trended down a little bit now, but clearly Hispanic and African-American communities are disproportionately represented in confirmed cases. And then the mortality data is really striking because, and as we've looked at the data, the average age of Hispanic individuals who are infected is lower than the average age for the African-American population. It's and the white population is probably somewhere in the middle, actually. But we've seen a lot more families, multi-generational households in the Hispanic community that have been infected. And so children and teens and younger adults, I mean, typically, adults in their 30s and 40s rather than 50s, 60s, 70s in the Hispanic community. And that's about the only factor that I can point to as a basis, a presumed basis for their preservation with respect to mortality.
That makes a lot of sense. I hadn't thought about that. Thank you for that insight.
Hi, Dr. Fox and Heidi, it's Amy Murray. How are we doing with hospitalizations?
Yeah, in general, we have been doing fine. Again, early in the pandemic, we had fairly typical numbers in the mid 40s up to about 60 patients hospitalized in St. Joseph County between COVID positive or patients under investigation. That was particularly the case when there was a very long lag time or turnaround time for test results. As that improved and as we got to the month of May, our numbers actually consistently came down. There were far fewer patients under investigation in the hospital, so that we were more typically in the 20s to 30. And now we're back up to about 40. Interestingly, it's disproportionate that St. Joe Health System has a disproportionate burden of hospitalized patients right now. Not many on ventilators or in the intensive care, fortunately. But one of the things we've seen, obviously, with the reintroduction of surgical and diagnostic procedures is that the overall hospital census is increased, even though the COVID patients represent a relatively small proportion of them. Surrounding counties in Elkhart, Elkhart General has a higher COVID census than Memorial does right now, for instance. And at one point, Goshen Hospital had a pretty significant COVID census. I don't know their exact numbers for this week, but one concern has been, overflow from Elkhart County hospitals coming to St. Joe County. There's been a little bit of that, but not significant to this point. But the hospitals certainly are feeling a bit of a crunch just in terms of overall hospital census, not specifically attributable to COVID. So we have, plans that they could ratchet back down on surgery and other diagnostic procedures to free up more hospital beds. It would take a couple days for those to work through the system, basically, but that would be, a step that could be adopted. And we discussed these things within Unified Command about kind of the time frame in which we would need to consider those.
Any other questions? We have time maybe for one more. Yeah, John, and then Emily, and we'll wrap up this session. John?
Just as Dr. Fox, just as a follow-up to that. So have hospitalizations trended up from June to July, gone up, and then overall capacity wise, are we okay? Or what's your sense of, following the trends of these increasing cases? Is there
our COVID hospitalizations have gone up slightly, from middle of June to now. So over the last month, they're still not as high as they were back in April, which is when we had the most significant. In April, we had the most significant COVID census, but we had tons of excess hospital capacity because there were no elective procedures and limitations on other diagnostic procedures and things. So we really had plenty of hospital capacity in April as we were kind of gearing up for surge potential. Right now, our COVID census is up a bit. There's a little bit of stress in the system. I mean, we're keeping an eye on it. There is still capacity currently, and we're okay with respect to ICU and ventilator capacity at this point.
Emily?
Thank you.
Okay. I actually had two questions, and they both can probably be answered pretty quickly. Is the turnaround time for testing, how is that looking? And then also, I'll give them both to you. And then also I had a question about I know the Motel 6 quarantine center closed, and so I'm just wondering where things stand as far as finding other alternatives for that looking forward.
Yeah, both important questions. So there certainly has been, testing for hospitalized patients, for patients who are seen in hospital emergency rooms, and in many of the urgent care centers, there's rapid testing available with turnaround time of either same day or next day. So if we take those results out and really look at standard outpatient laboratory processing, we had been running 2 days pretty consistently through May and June, and really since the beginning of July, maybe the very end of June, that has crept up. It had gotten out to about 6 days, 5 to 6 days more routinely. Seems to be improving a bit, particularly for specimens run by LabCorp. At one point, you may remember from previous meetings, I said LabCorp was doing probably 90% of the tests in the county. That's not the case now. They're still doing a significant volume of tests, but there are other lab players in the mix with different testing sites and more practices testing and things, including CVS and other entities. So LabCorp results currently are running 3 to 5 days. So it's a little bit improved from what it was the first week in July. Most of the other entities are out, 7 to 10 days. So significant delays, depending where those specimens get shipped is really the bottom line determinant. We are told that LabCorp is adding additional capacity by the end of July with additional machines. So, and for a while they were receiving a fair number of out-of-state specimens for processing in South Bend. So with increased capacity, they'll again be able to prioritize local specimens. So, based on what we're hearing from LabCorp, we should be in reasonable shape as far as testing capacity and turnaround time for the specimens that they process. For the IQC, today is the final day of the contract with the Motel 6 in Roseland. So we really began the ramping down process about 10 days ago, not taking any, not registering any new guests at that facility in that time, and allowing people, time to finish their isolation or quarantine as required. We've been working with homeless service providers to increase their capacity for isolation and quarantine of guests who are already in their facility. So we have some capacity there. We remain challenged with respect to individuals either in other congregate living settings or homeless individuals that are in the tent city or otherwise not sheltered currently. Right now we do not have an alternative plan in place. We've evaluated a number of different, hotel options and apartment buildings and houses, and we've explored, Bob especially, and he may want to throw in more comments here, but has been working tirelessly to find additional site for an isolation quarantine center. Our thought had been that the number of cases would be relatively small through the balance of the summer, and we really need to be prepared for a ramp up in activity with fall and cooler weather and the onset of flu season. There clearly will be a need at that point. With our increased activity here locally, we may need that capacity here sooner rather than later. And honestly, right now, that's an unmet need for people who are not already engaged with one of the homeless service providers. So we're continuing to work on that. So not the best news that I wanted to report there, but that's where we are at this point.
Thank you.
Thank you. Thanks, Mark. So moving on to new business, agenda item number 7, we're going to discuss the resolution that the board has put together. So as I stated at our last meeting, the board will present and vote on the resolution to declare racism as a public health issue. I am going to read this document in its entirety. Then I will ask for a motion to accept and a second, of course, and then we'll followed by discussion and then finally a vote to accept this resolution. So this is resolution number 1 for 2020. A resolution by the Board of Health of St. Joseph County, Indiana, declaring racism is a public health crisis in St. Joseph County. Whereas racism is defined variably as a system of structuring opportunity and assigning value based on the social interpretation of how one looks that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. Prejudice, discrimination, and antagonism directed against a person or people on the basis of race or ethnic group typically one that is a minority or marginalized. A belief that race is the primary determinant of human traits and capacities, and that racial differences produce an inherent superiority of a race. A system of race-based prejudice with social and institutional oppression. And whereas racism adversely affects lifelong health outcomes beginning even before birth, and whereas racism creates inequities, harms individuals and communities by causing unequal access to quality education, employment, livable wages, healthy food, stable and affordable housing, and safe and sustainable communities. And whereas the National Institutes of Health reports that multiple studies suggest that experiences of racism or discrimination raise the risk of emotional and physical health problems, including depression, cardiovascular disease, hypertension, and even death. And whereas the negative repercussions of historical racism, including but not limited to racist federal policies and practices, continue to negatively impact Black individuals and communities of color today. And whereas Black infant mortality in St. Joseph County is more than 3 times higher than white infant mortality. And whereas Black life expectancy in St. Joseph County is 5 years less than white life expectancy. And whereas 43% of Black children and 33% of Hispanic children in St. Joseph County live in poverty compared to 14% of white children. And whereas Black median household income in St. Joseph County is $27,000 and white median household income is $56,000. And whereas Father Jenkins, John Jenkins, president of the University of Notre Dame, wrote that we are compelled institutionally and individually to combat the sin of racism and to work to include all fully in our community. And whereas the city of South Bend mayor, James Mueller, said, systemic racial injustice negatively impacts the health and well-being of our communities of color. Health disparities and higher infant mortality rates should be a call to action. We must continue the important work of pushing for racial justice in all aspects of American society, including public health. Whereas racism exists on systemic, institutional, and interpersonal levels and persists across generations. Now, therefore, be it resolved by the St. Joseph County Board of Health that we declare racism to be a public health crisis that affects all members of our community and deserves action from all levels of government and civil society. We commit to a Board of Health that engages in frank and open discussions of race and the impact of the decisions we make upon racial inequities in our community, that these discussions will be integrated into our daily work together, and that we will address issues of race and racial disparities in a full and forthright manner. Provides educational opportunities for the board of the St. Joseph County Department of Health on matters of racism and implicit bias. Will promote greater diversity on the Board of Health. We will also commit to hold accountable our Department of Health to hire and promote individuals of color within the department. We will support the health officer and the department's plans to do the following: develop a health equity, epidemiology, and data unit within the St. Joseph County Health Department that will conduct an equity-focused health impact assessment, define baseline data regarding health disparities and equity in St. Joseph County, identify factors contributing to health disparities, and examine and implement best practices to minimize health disparities. Recruit, hire, and deploy community health workers of color with lived experience to strengthen relationships between the St. Joseph County Department of Health and the communities it serves, and to work in partnership with the community to reduce health disparities. Explore with law enforcement, emergency response units, hospital systems, behavioral health systems, and other local and state partners the feasibility of creating, funding, implementing, monitoring, and evaluating a pilot program of crisis intervention consisting of interventionists employed by the Department of Health to provide mobile crisis intervention in response to non-criminal situations such as substance abuse, mental and emotional crisis, and dispute facilitation, providing assessment, intervention, and transport to services as needed. Develop and implement a strategy for evidence-based harm reduction strategies, identify and implement evidence-based best practices for the primary prevention of trauma, and to nurture resiliency among individuals, families, and communities that suffer trauma. Now, therefore, be it resolved by the Board of Health of St. Joseph County, Indiana, that the above referenced resolution is approved on this day. I would like to now call for a motion and a second.
So moved.
Second.
I second.
Thank you.
Second motion? I'm sorry, I didn't hear who seconded the motion.
Migliori.
Thank you.
Thank you. I'd like to now have discussion about the resolution, so I would open it up to the board if anybody has questions or discussion points.
Just one comment or question, especially regarding support the health officer and the department's plans too. I'm speculating a little bit that those items are all rolled into the strategic plan of the department. Is that likely
correct,
what's
John.
going to, I mean,
Right.
those will be mirrored up?
Yes, and let me also add for everyone's knowing that this document was drafted in collaboration with the Department of Health. The board has had an opportunity to review, as well as Department of Health employees. So this has gotten a wide read, and we've had lots of good input, and I think we've come up with a really quite high quality document.
All the verbiage that's contained in there is there's a lot of it. I support it. Maybe it's not exactly worded the way I want it, but the intent is clear and has my support.
Awesome. Thank you, John, very much for that. Well, if there's no further discussion, then I would like to take a vote. And I'm going to do the vote just a little bit different. We're going to do a roll call vote. I think that this is a very important moment for our Board of Health and for our community, and that it needs to be demarcated by taking a formal roll call vote. So I've asked Jenny Parcell to read off each of the board members' names, and then you will answer accordingly. Jenny?
Dr. Marker?
I approve.
Mr. Lynn?
I approve.
Dr. Kirsch?
I approve.
Dr. Migliori?
I approve.
Ms. Murray?
I approve.
Ms. Dean?
I approve.
Dr. Bidinger Burnett?
I approve. And there we have it.
Excellent. Thank you.
We have passed this resolution. As I let out a huge sigh, this has been an important process. And I wholeheartedly want to thank the board members who spent a great deal of time reviewing documents, reading things, and getting us to this place, and extending that same gratitude to the Department of Health staff for putting this together. So I commend us on getting us to this point. But of course, as we all know, this is just the first step. Now it's time to roll up our sleeves and make sure that we're holding ourselves accountable to our document and to our words. So thanks, everybody. Okay, so let's move on to our next agenda item. We're going to talk about the Water Resources Advisory Board. I'm excited to proceed with this next agenda item. We've been talking about this for some time. The board is responsible for appointing 5 positions on the Water Resources Advisory Board. I'm going to read the positions and then the names, and then followed with a motion, discussion, and a vote to accept these folks. So the 5 positions that our board is responsible for on the Water Resources Advisory Board: the medical doctor, who is going to be Robert Einters, the biologist, Dr. Ronald Hellenthal from the University of Notre Dame, a geologist / hydrologist, David Jeffers with Roberts Environmental, hazardous substance management experience, John Lankowski with IDM, and then finally a chemist, and that is going to be Christopher Dunlap from St. Mary's College. So these are the 5 positions that we need to approve. And so may I have a motion to accept these 5 and so that we may discuss and vote.
So moved.
So moved.
I'm sorry, I didn't catch that.
So moved.
Okay, John, okay.
Yep. And
Seconded by Dr. Kirsch. All right, thank you.
thank you. And now open it up for discussion. Does anyone have comments or questions about these appointments? You've all received their resumes and so forth, so I didn't know if anybody has question or comments about this.
I read their resumes and I think, John, you did a great job, and also our environmental team did a great job recruiting these people. They all seem extremely well qualified, and I'm happy to support their tenure.
Here, here.
Awesome.
And I've worked with Dr. Heller since '99 on various issues, and just phenomenal individual and extremely knowledgeable on both environmental, hydrology, and even I think he's on the State Board of Chemists too. At least he was. So it just brings such a broad perspective. He's awesome. Dave Jeffers, he's worked with him since the mid 2000s. Very good to work with. He's done some of the testing in the county, so he's a great resource. Of course, John Lankowski used to be with the health department, and he was a great in our environmental group. So he's knowledgeable of all the issues. I don't know Christopher John Dunlap, but his resume sure looks great, and feel like we're blessed to have him involved too. And of course, Dr. Einturns is awesome. So I support this thing.
I was just going to add a word about Chris Dunlap. He is the chair of the chemistry department over at St. Mary's College. And he was telling me that his kids have matriculated now to college, so he is no longer running around for sports and was just looking for a new opportunity to get involved in the community. And so this dropped into his lap. So I think that that's kind of awesome that it all worked out that way too. So
that's great.
If there is no further discussion, then I would say that we could move to a vote to accept these 5 individuals to serve on the Water Resources Advisory Board. All those in favor, say aye.
Aye.
Aye. All those opposed, say nay. The ayes have it. We have our folks for the Water Resources Advisory Board. Yahoo! Okay, so on to the next agenda item, which is on-site wastewater advisory board. Same situation. We have 4 positions that we needed to appoint. I will read those. We have for the municipal water wastewater system, we have Skip Davis with North Liberty Utilities. We have an at-large person that is going to be Kyle Bibby at the University of Notre Dame. A biologist, Dr. Hellenthal, again, he's serving in on both committees, University of Notre Dame, and then geologist, hydrologist, David Jeffers, again, serving on both committees. So may I have a motion to accept?
So moved.
Second.
Thank you. And open for discussion.
I'm sorry, who seconded the motion, please, Heidi?
Jason Marker.
Thank you.
She skipped 2036.
She did.
Did anybody have any comments about Skip Davis? John, did you work with Skip, or Mark Epsich might have worked with?
I think Mark knows him better than I do.
Okay.
I know of him, and I support that nomination.
Wonderful. Okay. If there's no further discussion, we'll move to a vote. All those in favor, say aye.
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 All those opposed, say nay. And the ayes have it.
Awesome. I don't know whether you meant to skip over and do 2036 last, but you did skip over 2036, item 2036.
I did not mean to skip over that. That is, we will go back and we will make sure that we talk about that.
Thanks.
That must have been a Freudian thing, I'm thinking. That's the only explanation I could come up with. I was all excited to get our water advisory boards on track.
Understood.
So Yes. Okay. So under agenda item number 7, we've got discussion regarding the ordinance establishing fines for those who are not in compliance with Public Health Order 2/2020. I would like to ask for Dr. Einters just to give us a high level overview, because of course the board, you've all had a chance to read, see, et cetera, et cetera. But perhaps Dr. Einters, if you could just give a real high level overview, and then we can have a conversation about it.
Sure, thanks Heidi. As Mark reviewed in the first part of this meeting, it's clear that there continues to be a significant amount of community spread of SARS-CoV-2, the virus that causes COVID-19. There are unfortunately relatively few measures that we can institute as individuals or as community to mitigate or stop the spread of this virus. One of those, or a couple of those, include wearing face coverings to prevent particularly the spread of virus from the asymptomatic or symptomatic carrier to his or her neighbor or acquaintance. And the other is good hygiene, particularly the use of hand sanitizer that's alcohol-based, 60% or more. We instituted the order in May 4th, if my memory serves me correctly, requiring individuals in closed spaces when social distancing could not be maintained, physical distancing could not be maintained of 6 feet, that they wear face coverings. And we also expected enclosed business establishments or establishments to have hand sanitizer available for employees and customers. The compliance with this order has been reasonably good, but there have been a number of outliers. That is the Department of Health's food and environmental teams have, over the last several months, fielded several hundred complaints from employees, from citizens about the lack of adherence or compliance with the public health order. Our environmental health and food safety teams have investigated these reports. And in general, most of the establishments, most of the individuals have been willing to comply, willing to listen to our staff and to do their best to comply. But unfortunately, there are some establishments that have blatantly and flagrantly refused to comply with this order. We had hoped, and I personally had hoped, that, if you will, a carrot alone would be enough to encourage all establishments and individuals to comply with the order. For that matter, I would have thought that one wouldn't even need a carrot, simply the notion that one was protecting the health of one's neighbor, of one's acquaintance, that in and of itself would have been enough to ensure near 100% compliance with the order. But unfortunately, that did not come to fruition. So after discussion among Unified Command, after discussion with a number of the elected officials, after discussion with individuals who lodged the complaints and others within the community, I decided to seek an ordinance that would give us, the Department of Health, the power to issue fines, to issue a penalty for establishments and individuals that are not complying with the order. Now, to be clear, we are not asking, and I will not expect businesses to enforce the order on their customers. We recognize that some businesses are able to do that and have done that very, very well. Menards, for example, is a terrific example of a business that has done an outstanding job of ensuring that their employees stay safe and that their customers wear face coverings, which in turn will keep their employees safe as well as their fellow customers. But we're not going to require that of businesses. What we will ask of businesses is that they encourage and post and remind their customers that, post signage to remind their customers that face coverings are required as public health or to be in compliance with public health order. And will, of course, will require employees of businesses when physical distancing cannot be maintained to be wearing face coverings. Employees of establishments, not just business, but really any establishment where it's indoors and physical distancing cannot be maintained. So the next step will be to, after discussion here, will be to finalize a draft of the ordinance, to submit that to the county council, to ask them then to review it, obviously send it to committee, and then move from that hopefully to a public hearing. Happy to respond to any questions that the board might have regarding this.
Does anyone have any questions? There is a question in the chat that that would be helpful to get clarification. So the order does pertain to persons and businesses. So while we're not asking businesses to sort of police their customers, what does it mean to say that this is going to be enforced with persons?
It does give the Department of Health the power to issue a fine to an individual. So it will give us that capability to do that. And just as, you know, we issue fines for a variety of different infractions that our environmental unit and our food safety unit respond to. And this will be no different in many ways than those fines. Individuals, establishments will be issued a fine. If they don't pay it, we will then turn to Mr. Keckley and the courts to enforce it.
Thanks. You know, to be clear, for our board, our role in discussing this is just to air any conversations, clarify anything for us. Our role in this is to offer our support to our health officer as he moves through this process. So I am proposing that we are going to vote in support of this process for our health officer. This is not for us to approve him, for him to process this. Dr. Einters is going to take this ordinance, this draft ordinance, and propose it to the county council. But I think it's important because it's such a significant piece. I think it's important that the board shows their support, albeit that it is more symbolic than anything else. It does not have any, you know, teeth to it or so forth. But I think it's important that we show solidarity here. So I think it's important.
Hey, you're correct. This is Dave Keckley, and you are correct in your statement. The board has oversight responsibilities. Dr. Einters, by definition, is the public health authority for the county, and he has then the responsibility to decide whether to take this type of action. But certainly there needs to be board knowledge, involvement, discussion, and then, as you stated, whether to support such an activity. So you are correct in explaining to the board members that what we're doing this afternoon is discussing and determining whether Dr. Einters has support of the Board of Health.
Thank you very much. Thank you for that. Any other discussion items? If not, then I would call for a motion for us to, I hadn't written this out, a motion to offer our support for the health officer to proceed with submitting the ordinance to the county council.
So moved. It's Amy Murray.
Amy Murray.
I'll
First,
second it.
I'm sorry, was there a motion to, was that your motion, Heidi?
yes,
And is there a second to that motion?
That was
Yes.
me.
Ilana
Dr.
Kirsch.
Thank you. I'm sorry, I'm just having trouble recognizing the voices.
No.
Thank you.
All righty.
Thank
okay.
you. And of course, there's no further discussion, so let's go straight to the vote. So all those in, sorry, go ahead, John.
Can I just briefly, before we vote, and I
Yeah.
don't know if it's appropriate for a little bit more discussion, and maybe one of the things I think might head off a few questions that might be coming is some of what the health department staff has had to deal with regard to disregard for the health officer's order. I just think that'd be helpful for those listening to understand that, we're not, the staff isn't, or the department's not, coming out of the clear blue with no good reason for this.
Right.
Did you want me to respond to that, John, in some way?
Yeah, if you could just a couple of examples of I think you gave the positive examples,
Sure.
but maybe where we're seeing the real problems.
I can give some examples of, but I am not going to name any businesses or any individuals, but I can certainly give examples of the sorts of complaints that we have received, and these come. We don't ask if these come from employees or if these come from customers. But we are sometimes notified by the individual lodging the complaint whether they are a customer or a employee. Most of our complaints have come from customers, but a significant number have come from employees of establishments, businesses who are concerned about their fellow employees and the lack of enforcement within the business establishment for the order. I can specifically read if you would like. Here's one complaint coming from one employee for an unnamed business. Supervisors must wear masks, but not employees who are on top of each other and working with machinery that doesn't get sanitized properly. That's one example. Another example of they talk about an individual who was tested positive but refused to notify staff and customers. And we have another example stating that an employee walked into our office to state that although management wears face coverings, employees are not complying and management is not enforcing. This is clearly, in my opinion, examples of where individuals are having potentially to choose between their livelihood and their lives. And I think that having a little bit of teeth, as Heidi said, or as perhaps I said previously, to the order would ensure a little bit more compliance and improve the health and safety of employees and the public.
Thank you.
Thanks, John. Any other discussion items or any from the board? So then I'd like to call for a vote in support of health officer to move this process along to deliver this to the county council. So all those in favor say aye.
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 All those opposed say nay. The ayes have it. thank you for that vote. We are now moving on to our final agenda item in the new business section, where we're going to do a unit spotlight on the environmental health services. So I will turn it over to environmental health services.
Hi, I'm Brett Davis. I'm the Assistant Director of Environmental Health. I'll be doing this presentation for Mark, who could not be in attendance today. Bear with me for a moment here while I try and share my screen with the presentation. There we go. All right, welcome to the environmental unit. It's directed by Mark Espig. I am the assistant director. We do have staff administrative assistant Jessica Dilling, staff assistant Letitia Wright, and 9 environmental health specialists, Brandon Gutierrez, Brianna McCall, at the time Cassie White, David Ekins, Jeff Morowski, John Ingstrom, Isaiah Hartman, Kara Dishman, and Patrick Savinsky. Cassie has recently taken on a new position within the health department, but in the interim, she's still assisting with environmental.
Like that with everybody.
Pardon?
Brett, you're kind of breaking up, and so you might want to be a little closer to your microphone and speak just a bit more slowly, and I think your presentation will go better.
Okay. Is this a little clearer?
Yes.
All right. I would like to bring attention to the fact that our staff does have 24 different specialized certifications and endorsements to help aid in our job here at the health department. We have certifications in pesticide application, emergency management, technology.
Brett, you're breaking up again. Can you move down here? If you want to move down into this room, can you run?
We certainly can do that. You get 20 seconds here.
He's just on the 9th floor, Heidi, and I think if it comes down to the 8th floor, it might go better.
Agreed.
Okay.
Can you, can you put me
unlock the door.
In the Department of Health conference room, can you guys bring up, Brett, if you would stop sharing your screen? Make sure you stop sharing your screen, and then Jenny, if you could share the screen there in the conference room so when Brett comes down, he can pull up his PowerPoint. While we are shuffling around a bit, why don't I go ahead and go on to agenda number 8, which is old business, the Board of Health Strategic Plan update. So just providing an update for all involved. We've been working diligently on this document, and we plan to bring that to the full board for next month in August. And then board notifications, as you can see, hiring, resignation, retirements, termination, we have none, but we do have a promotion. Cassie White has been promoted to the Department of Epidemiology. And Dr. Einturns, if you could just say a moment, what will Cassie be doing? What's her promotion?
I certainly can. Give me just 2 minutes here.
Sure.
2 seconds, rather. So we've asked Cassie to take on responsibility for directing our health equity epidemiology and data unit. And this is a new unit. In part, we've had epidemiology before, but we wanted to include more of a focus on equity. And by equity, I'm of course speaking about matters of not just disparity, but disparity and injustice. So looking at matters of fairness in addition to just differences due to other causes. And we're looking forward to her taking up a lead there. She will be working with Mark Fox and me on a plan specifically for that, strategic plan specifically for that unit that integrate nicely into our overall strategic plan.
Awesome. Thank you. And congratulations to Cassie on that promotion. That's awesome.
So he can
yeah.
pull it up. He'll be able to pull it up.
So Brett's in the room now, and we're working on getting the screen sharing, and give us just a second here.
Okay.
Click up on the top. Just go to the red X. Okay, then go back to it. Go back to share screen. Yeah, and then the blue button.
Here, oh, there we go. You had it.
Cool.
There you go. All right.
Awesome.
Thanks to Robin Vita for letting us know how to do this.
Okay, take two. Once again, I am Brett Davis, and this is environmental health. Maybe.
Can you hear okay, Heidi? Okay, good. You got thumbs up, so go ahead, Brett. Okay, sit here, we can put the camera on if you want. All right.
We have, Jenny have the clicker.
I can't get it, don't worry about it. I'll click
All good.
you do.
All right. So the environmental unit is directed by Mark Espick. I am the assistant director. We do have two lovely assistants, administrative assistant Jessica Dilling and staff assistant Tisha Wright. We have 9 environmental health specialists, Brandon Gutierrez, Brianna McCall, Cassie White, David Ekins, Jeff Morawski, John Engstrom, Josiah Hartman, Kara Dishman, and Patrick Savinsky. As noted, Cassie has since taken a promotion within the health department, and but in the interim, she is still assisting with environmental, and we certainly wish her luck in her new position. I would like to note that environmental staff do have 24 specialized certifications, endorsements, other sorts of accreditations that do help us in our jobs doing what we do with environmental health. Those fall in line with environmental remediation, pesticide application, septic system design review of multiple different specialized septic systems, lead risk assessors, and certainly many more specialized trainings that don't have a piece of paper to go along with it. If you are ever of the opinion that something is happening and somebody in government could probably do something about it, you're probably looking at environmental health. We do anything and everything, basically. Our current scope is combined animal feeding operations, healthy homes, air quality, massage establishments, tattoo and piercing establishments, vector control, property transfers, septic systems, solid waste disposal, surface water, groundwater protection, well drilling, well protection, subdivision rezoning, and many other things that do not fit on that list. We took a complaint today about somebody dumping tubs of raw meat in the woods behind a house. We took a complaint about hornets burrowing into the yard. We get all sorts of calls that's our job. Figure it out, make it happen. Start out with some well drilling and water quality information. We are one of the very few counties in the state of Indiana that has an ordinance that requires water sampling. ISDH has often used us as a benchmark
when giving presentations throughout the county on a well-written water quality ordinance. All new wells that are drilled in St. Joe County are sampled for total coliforms, E. coli, nitrates, and arsenic. We also do wellhead protection for the municipal wells. Oh, lost it. That made things significantly worse.
We lost it on the screen here.
Oh, we have to go around it.
I'll say we can still see it, but I'm popping over. I could still see it. Did it come back up, Brett?
No.
Okay, hold on.
Well, it's just not on our screen, but if you can see it, then we'll just keep talking.
Yeah.
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 I got a paper copy right there if you need
Hang on,
it.
I'll just steal my copy. That way I can have my notes or what's left of my notes. All right. Wellhead protection. Around the municipal water supply wells in St. Joe County, we evaluate sources of potential contamination. Dry wells in parking lots, specifically those that are in gas stations and other sorts of pollutant-heavy locales. We have geologically delineated 1 year and 5 year travel times between those potential point sources of pollution and the municipal water supply well. And we do regular sampling and inspections of those properties to make sure that they aren't contaminating the groundwater that goes to the citizens of St. Joe County. There's over 13 square miles worth of wellhead protection areas. And we are in the midst of creating a new well protection area for a new subdivision that is going to be going in the Southeast Ranger area. They're going to have a common well field. Now, it will be our job to help monitor and make sure that these 300 new homes, or whatever it may be, at Mount Development, make sure that their water quality is also as good as it can be. We do have 9 square miles worth of administrative control areas. These are areas that are known to have groundwater contamination, sites such as the old Studebaker plant over off of Chippewa, Buckeye oil terminal up there off of Adams Road. It's a source of some prior spills in years past. Several other areas such as that where we do restrict new wells being put in, make sure that there's sampling done so that way we can tell if the water is improving or not improving, if there are certain things that can be done to mitigate future issues, and just generally keep an eye on things. We are also heavily involved in the Judy Creek Neighborhood Water Sampling Project. There is a subdivision that has a plume of sodium chloride in the groundwater as a result of road salt storage. And so we do annual sampling out there to make sure that those levels aren't getting worse. And if there are other houses that need to be given reverse osmosis units, or if there are other homes that are seemingly doing better, that we can take them off of certain restrictions. So that's a brief interview into the water side of environmental. All right, on-site sewage, probably known as septic systems. Septic systems are a very big deal in St. Joseph County. 4 in 10, roughly 42,000 septic systems are currently in use in St. Joseph County. This is the result of haphazard development for many decades. Relatively favorable soils that led people to kind of put a blind eye to sewer expansion, and just still a reluctance to expand those sewers. The vast majority of the state of Indiana has clayey soils. As long as you're north of the bypass, for the most part, you've got relatively sandy soils, and your septic system works fairly well, at least in the sense of disposing of the effluent. Nowadays, we want to make sure that sewage not only being disposed of, but being treated, so that way the water quality is maintained. We issued over 500 permits in 2019. We don't anticipate that number decreasing, and the septic system business is quite booming. The State Department of Health has delegated the review of small commercial systems back to the Department of Health. For the most part, the State Department of Health handles the bulk of commercial septic designs. However, the ones that are under 750 gallons per day usage do kick back to us for us to review. We also have 8 cluster systems throughout the county. Cluster systems are septic systems that handle, we have some that handle strip malls or a block of restaurants. We have some that handle entire subdivisions. And like I said, we have 8 of those throughout the county. And right now, our cluster system, there's a lot of data coming in for cluster system management. And I asked that to be included in our strategic plan to help create a better cluster system management program to really evaluate the data we're getting in, to make sure that we don't suddenly end up with thousands of people without a septic system due to system failures or other sorts of issues that could potentially arise. So far, we've had no issues, but I don't want us to bank on prior good luck to ward off future bad luck. Healthy homes and air quality. We respond to complaints regarding out of water, garbage, food waste, feces, rodents and cockroaches, mold as necessary, burning, people dumping meat in the woods. I mean, everything. We condemn dwellings that are unfit for human habitation. We have condemned houses that have had, I recall, one property where a gentleman was having some mental decline in his age and had lost the sense of smell, and the inside of the property had really deteriorated to the point where it was not safe for him to continue to live at that property. So we did end up having to condemn that house. It later did get cleaned up and everything was taken care of, but we did step in to make sure that that gentleman was safe. We also process clandestine laboratory occurrence reports from ISTH. That's fancy for meth lab reports. We haven't had a whole lot recently, but that doesn't mean that meth is necessarily going away. But we do follow up with those, make sure that they are actually getting cleaned, and making sure that those dwellings are safe for people to move into, and so that way nobody is getting any sort of poisonings from residuals from those meth labs. The board is quite familiar with the lead problem that we have in St. Joseph County. We do have 3 certified lead risk assessors handling pair requests, HUD inspections, and risk assessments for elevated levels. We do have a department-wide collaboration for Lead Poisoning Prevention Week, and we give presentations to the public and to groups. We're on different committees and different advisory boards, just trying to make sure that the lead problem does get mitigated in the county. Don't want to dwell on that too much because you're all very well aware of the importance of lead in our community. Vector control. The vector control program is in the midst of being revived in full after a decade of dormancy. At one point, St. Joseph County had one of the largest programs in the state of Indiana, and it basically all got mothballed in 2009. We had thousands and thousands of dollars of stuff sitting in storage, and the timing of everything really helped bring to light the need to revive the vector program. Last year, as you may recall, there was the Eastern equine encephalitis outbreak in southern Michigan, as well as Elkhart County and other Noble and Steuben counties, I believe. Triple E, 1 in 3 who contract Triple E, it is a 1 in 3 chance of a fatality. It is a very serious disease, serious enough that the State Department of Health was able to get grant money to do aerial adult deciding on very short notice last year. I would like to point out that St. Joseph County data was very instrumental in securing that spraying. And so we're building on to what we are currently doing. West Nile virus is endemic in the area. As Dr. Einters noted earlier, we have already received our first West Nile virus case for the year. It's actually only the second case in the state of Indiana. And we were able to find it very early. That was from a trap that we had collected 1 day prior to having the result. Thanks to the additional funding that we received, we are now able to do West Nile virus testing in-house. Prior to this year, all testing was done by the State Department of Health. And so the mosquitoes were collected, sent to ISDH, and approximately 2 weeks later, we would get a result back saying, hey, by the way, you had West Nile virus 2 weeks ago. Which is important information to have, but it's much better to have the result instantaneously. And so we are now only the 4th county in Indiana to have the capability to do testing at the local level. We already did spraying to mitigate the West Nile virus threat in eastern Mishawaka. We did follow-up trapping in that area, and I can say with certainty that trapping did have, or that spraying event was a success, and I do feel comfortable and confident that we did severely mitigate the threat of West Nile over the 4th of July holiday. We also have some additional tasks that aren't necessarily everyday things. As mentioned, the combined animal feeding operations. We don't actively permit those right now, but we still respond to complaints. But rest assured, citizens of St. Joe County, IDEM also has jurisdiction over those facilities and is still taking care of it. For solid waste disposal, think of it as like your garbage trucks and your junk haulers. There are 18 companies that have pulled permits totaling 228 vehicles that we have permitted. tattoo and piercing establishments and their practitioners. There are 22 facilities licensed by St. Joe County Department of Health that have 62 practitioners. And for massage establishments and massage therapists, there are 57 establishments throughout the county with 122 permitted therapists. We also have obligations beyond just the Department of Health. We do have representatives on the Plan Committee of the Area Plan Commission. We do reviews for subdivisions and rezonings, making sure that new development is not going to negatively impact the water table or other environmental aspects. We do have a member on the Regional Water and Sewer District. We have members on the Judy Creek Task Force, the St. Joseph River Basin Commission. We participate in Building Department Plan Review, so various different remodelings, additions, changes of use. We all make sure that those changes of use aren't going to negatively stress the existing environmental infrastructure. We take part in lead affinity meetings. We have a member on the Indiana Tick-Borne Illness Advisory Committee. And we have given presentations to IUMed, City of South Bend, and countless other organizations throughout our community. At request, I kept the presentation relatively short, and I would be more than happy to answer any and all questions from the board.
Thank you, Brett, for that excellent, informative presentation. I learned some new things. So I'm pleased to have seen this presentation. Awesome job. Boy, you guys are hard at work. I want to open it up to the board. Do we have questions? Anything? Yes, Dr. Kirsch, please.
Not a question, but just a comment, Brett. I'm so impressed. You attend all of our meetings together with Mark, and you do a lot of presentations, but like Heidi, I don't think I realized I knew that you were doing a lot, but I don't think I realized the full extent of how hard you and your entire team are working. And I just want to say on behalf of the board that, we thank you for that, for helping keep all of us safe. As a citizen of this county, I really appreciate all the hard work you do.
I appreciate your comments, and I assure you that we're doing the best we can because everybody deserves the best that we have.
Oh, awesome. All right. Thank you, Brett, very much for your presentation. Really appreciate it. You guys are doing an awesome job. Thank you. All right, guys, as we move into our final segment, agenda item number 10, this is our public comments segment. At our regular meetings, the public is invited to address the board for 3 minutes regarding items that are posted or not posted on the agenda. Individuals may speak once during the section of the agenda. Speakers shall be properly identified, which you have already done so in the chat box. Personnel issues are not to be addressed during open sessions of the Board of Health, and the board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, or obscene. And just as I've done in the past, I have my phone right here, so I will keep time. And I've already written down everybody's name, and I've put them in the order in which they were put into the chat. And so I'd like to begin by calling on Kelly Haven, and you have 3 minutes, please.
Okay, my argument against a mask enforcement ordinance is twofold. One, the science doesn't support it, and two, whether or not masks make a difference, it's wrong to take away the individual's right to choose. You have been hearing dozens of citations questioning the efficacy of masks, especially when contrasted with the negative side effects of masks, which is a health issue, right? The two references that stand out most in my mind are one, a citizen advocate named Peggy Hall, who researched all 7 of the studies on the CDC website in support of masks. And she found that every single one of them concluded only that more study was needed. And two, former OSHA MD, Andrew Kaufman, speaking out that masks are harmful to workers engaged in physical activity and should not be worn by them. This is America, where we leave decisions to the individual wherever possible. Thousands of people have car accidents every year, but we don't ban cars. Thousands of people die on bicycles every year. We don't ban bicycles. Thousands of people get head injuries from falls or other accidents, but we don't mandate that they wear a helmet all the time. Why? Because of the law of diminishing returns. I mean, it is a fact, an undeniable fact, that we could cut the number of fatal heart attacks in America down to half or better if we would just put a fire station on every corner. But we don't do it. Why? Because the billions of dollars that we would spend on that wouldn't go into food programs or cancer research or schools, and it would break our economy. So we just wouldn't do it. The damage would outweigh the benefits. Well, I think this mask ordinance is like that too. All of us people know the recommendations. Many, especially those at risk, are willingly following them. And then there are businesses who want to cater to those customers. But there's also a group of less at-risk people who want to get together with other less at-risk people at their own risk. And there are businesses who want to cater to those people. So in a free market economy, the right proportion of businesses will respond to customers in both categories. And that's what a free market does. So doesn't it strike anyone as significant that the only group in America to reach herd immunity so far is that group of Jews in New York City who insisted on gathering together? If herd immunity is one of our goals, then I would suggest that those of us who can herd together should do so, and then be careful and sensitive to those who can't. Well, how would we know who's who? Wouldn't the easiest thing to be to let each individual, each church, each club, each business define whether they're
Thank you, Ms. Havens. That's the 3-minute time. Thank you very much for your comments. We'll move on to Miss Amy Drake. You have 3 minutes. Miss Drake, you have three minutes.
She's still on mute.
Ms. Drake, you're on mute.
Can you hear me now?
Yes.
Yes.
Okay, I'm sorry about that. This unelected board is becoming more of a police force every day. At first, the board thought that the governor was opening up the state too early, and so they gagged us with masks, even though there were indications of the curve flattening. And instead of letting the mask order run out on July 4th, they extended it, because who needs data when you have power? Then they cracked down on businesses not following orders, and several local businesses were shamed in the South Bend Tribune. At the same time, they spoke of a new campaign to publicly praise businesses that are taking the order seriously. How Orwellian. The next step, they said, would be considering fines for businesses. But before it could even come up at today's meeting, surprise, surprise, the health department now wants to fine patrons. How quickly you grab power. At what point do you start taking away the licenses of struggling businesses and jailing people for disobeying your orders? They're doing that in Michigan, Ohio, and Colorado. Government always encroaches, and you are certainly playing that part well. The health department will have no detractors, no matter that the science doesn't show masks work or that they are not in our best interest. You are conducting a scientific experiment with masks based on a hypothesis, and not all of us are willing participants. At first, the health department said masks were why our county wasn't overrun with coronaviruses. Today, cases are the highest they've been and continuing to increase. The reasons that we do not need masks are these. The science is bad. The moisture retention, reuse of cloth masks, and poor filtration may result in an increased risk of infection. The New England Journal of Medicine doesn't recommend them for the public, stressing that COVID doesn't spread in passing encounters and that masks offer little protection. Masks have not been shown to stop the spread of influenza. Number two, we do not have an explosion of deaths in our county. We have an explosion of deaths in our nursing homes. So the health department needs to shift its focus. 75% of deaths here were in nursing homes. Number three, most people under 50 and in good health are at almost no risk of dying. Kids are more likely to die from lightning and the flu. Kids are also considered less likely to spread corona. Even OSHA says employers have the discretion to determine whether to allow employees to wear face cloth coverings in the workplace based on the specific circumstances present at the work site. In some workplaces, masks could pose a hazard, such as absorbing dangerous chemicals in the environment or from infectious contaminants in the atmosphere. A plaintiff arguing about masks in a Washington court described masks this way: compelling free individuals to wear face masks forces them to espouse support for the scientifically unsupported lockdown measures and draconian government intrusion into citizens' daily lives. We do not have evidence-based proof that masks work, and consequently, government has no right to mandate them. Without the science to back them up, they can only be understood as a social control method to keep us continually fearful and ready to accept whatever mandates.
Thank you, Ms. Drake, for your comments. We will now turn it over to Brandon Brumbaugh. You have 3 minutes.
It's scary that we're sitting here in America glossing over such basic American concepts. What is the threshold we are establishing here for when the government has the right to compel or prohibit everyday behavior of its citizens for the public good? And that's assuming this is for the public good. The data on the efficacy is problematic, but sure, having some sort of barrier logically would make some difference in containment, ignoring known contexts where it causes more harm than good, such as in persons with existing breathing issues. And how would that be handled, by the way? Are people to be fined, the people to be fined for not wearing masks and the businesses to be fined for allowing an unmasked patron going to be investigated to make sure that the individual was within 6 feet, since currently it's an either or, and then be compelled to violate HIPAA laws to satisfy that medical exceptions are or not met? And who decides the threshold for such exceptions? And what colossal threat to America are we willing to make these sweeping decisions for, discarding our fundamental hatred for tyrannical mandates that led to our Declaration of Independence? Something that we don't know much about, but appears to statistically resemble a number of other flus in recent memory. Why is this one suddenly the end of the world, reminiscent of 2001's unjustly sensationalized Summer of the Shark? Because it skews more towards the elderly, and while our aging politicians had no interest in moving to save younger victims before, they will tear down the fabric of our free society to protect themselves. But really, past this, the issue is one obviously not of pure scientific data, but of human rights. Bioethics, the commonly held first and highest priority principle of which is respect for persons, respect for their autonomy as individuals. Scientists need to examine not just the public good aspect of something, they need to examine the damage to the individual, which is an important component of our societal health. We do not want perfume tested in a rabbit's eyes, even though it could prevent human suffering. Yet you will compel a bunch of already stressed, scared people to embrace the panic and make another huge life change as they watch their lives crumble around them. So consider that even if we had all the data and could show significant reductions in contagiousness, there is a cost that we used to consider in this country, civil rights. This echoes the trendy cancel culture behavior going on. I do not like something someone else said or did. Therefore, the offense is causing me harm. Maybe we can declare it a public health crisis since everything is connected to health after all. And it's now worth tearing down the right of all of us to freely express ourselves by forcibly absolving us of personal responsibility. No, a carrot alone is thankfully not enough to make all of us forget what makes America, America. I hope your trap isn't either.
Thank you, Mr. Bumbaugh, for your comments. Andre Stoner, please, you have 3 minutes.
My name is Andre Stoner. I live in Cushing Street, and I am with Faith in Indiana. I just want to address a number of the issues on your agenda. First of all, I want to thank you for your leadership in establishing 2 full-day testing sites on the west side. I think that is really critical to serve especially the African American and Latino communities who have been disproportionately impacted by the coronavirus. So thank you for that work. Appreciate that. Also, just want to commend you for the resolution declaring racism in St. Joe County a public health crisis and following up with very concrete action steps. I think we will, look back. I want to commend you for your courage to honestly address the reality of our situation, but also your creativity in finding ways to work at that. So I think we will look back in 10 years and we'll say that was a pivotal moment. I hope so. I think we could, when the well-being of our community as a whole was dramatically impacted. And then I want to just address this question about masks. I think a significant role of government is to serve the common good. And I want to express appreciation for the health department and your leadership. I think your leadership is one of the reasons that our county is doing better than some of our neighboring counties. And I know for my sake and for myself and for others in our congregations, I am glad to undergo the inconvenience of wearing a mask if it might protect the life of someone else. And so I think this is an important measure. You've shown leadership, and I support you in continuing to try to help us be a safe community. I would just urge you to think, I appreciate that there's a significant amount of focus on retail and consumers, but I urge you to think about workers as well, especially not just the retail area, but the manufacturing area. So again, thank you for your leadership on all these fronts. Really appreciate the work you're doing.
Thank you, Mr. Stoner. Jen Towers, you have 3 minutes.
Hi, my name is Jen Towers. I'm a citizen who actually has a health condition that prevents me from wearing a mask. I make every effort to always maintain social distancing when out in public, as well as I have good hygiene practices. My life already consists of explaining to store employees about my medical condition, more knowledge than they actually deserve to have. As a primary caregiver to my son, I was recently unable to attend multiple his health appointments because they denied me entry without having a mask. I have been denied entrance to stores regardless of my health condition. And one of my concerns is that with the introducing of fines that I've seen on social media, people being confronted by other people about not wearing a mask, being attacked, being videoed, being photographed, like was suggested in Indianapolis. If you see someone without a mask, to photograph them. I don't think the public fully understands what the fines would entail. I don't think the stores, I think out of fear that I would be continued to be denied entrance into stores, I would be continued to have to disclose my personal medical condition with other people. And I would really like to not see that confusion. Another point I would like to be brought up is mental health. During this pandemic, I really feel like our health departments across the country have really done a disservice to address the mental health issues that people are having in light of this pandemic, the stress, the additional suicide rates that have gone up, the additional depression and anxiety. I really would like to see that information addressed. Thank you very much.
Thank you very much, Ms. Towers. Jane Greenwood, you have 3 minutes.
Okay, W.H. Kellogg, he's an infectious disease expert and then the executive officer of the California Board of Health, said that masking was not helpful to stopping the spread of the 1918 influenza pandemic. The masks, contrary to expectation, were worn cheerfully and universally, and also contrary to the expectation of what should follow under such circumstances. No effect on the epidemic curve was to be seen. Something was plainly wrong with the hypothesis. In the May 2020 CDC policy paper, it said, although mechanicalistic studies support the potential effect of hand hygiene or face masks, evidence from 14 randomized controlled trials of these measures did not support a substantial effect on the transmission of laboratory-confirmed influenza. We did not find evidence that surgical type masks are effective in reducing laboratory-confirmed influenza transmission, either when worn by infected persons or by persons in the general community to reduce their susceptibility. And the New England Journal of Medicine on May 21st, 2020, they stated, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact with 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. An April 2015 study by the BMJ, which is an international research journal, stated, this study is the first randomized controlled trial of cloth masks, and the results caution against the use of them. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Further research is needed to inform the widespread use of cloth masks globally. However, as a precautionary measure, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. Dr. D.A. Henderson, who helped eradicate smallpox throughout the world and was dean of the Johns Hopkins School of Public Health, stated, studies have shown that ordinary surgical masks does little to prevent inhalation of small droplets-bearing influenza viruses. The pores in these masks become blocked by moisture for breathing, and the airstream simply diverts around the mask. There are few data available to support the efficiency of an N95 or any surgical mask outside a healthcare setting. Even when masks are supposedly held up as scientifically proven, they are not. Consider the June 13th headline in the Washington Post. New research supports wearing masks to control the virus. The article discusses a broad review funded by WHO and published in Lancet, which concluded the data from 172 observational studies indicating wearing masks reduces the risk of coronavirus. But then there's the kicker. The conclusion came with the important caveat. We have low certainty in that, said the man behind the study, meaning the authors cannot be strongly confident in the result. Thank you.
Thank you, Ms. Greenwood. That was exactly 3 minutes. Thank you.
Good.
And next is Sally Dixon. You have 3 minutes. Oh, you're on mute. Yeah.
Okay, can you hear me? Yes. Okay. I feel like I really should have written down my remarks.
You're on mute again.
Oh, it's me.
Oh no.
Is it good now?
Good now.
I'm sorry, it just keeps going back to mute. I don't know why. I just want to say, so in full disclosure, I do work for the Department of Health, but I'm not involved in any way in the emergency preparedness or in the COVID response. I work on a grant for infant and maternal mortality. So I was at home from March through May, and I'm back working now. And so I'm here as a citizen today because I appreciate the decisiveness and the thoughtfulness of our Department of Health, and for that matter, the way our elected leaders have worked with the Health Department to observe the best advice about the early mask order. You know, we hear a lot about the objections that it's only people in nursing homes or children don't get as sick, but nobody everybody lives in a bubble, and the virus doesn't just appear in nursing homes, it walks in through employees. And so we all have, I feel we all have to do our part, especially.
We lost you. You're on mute. Oh, there you go. You're fine.
That's strange. Sorry. I feel like we have to do, all of us have to do the part to reduce the community spread so that schools can open. That's what makes it safe to do that, to have the least amount of virus in the community. And I think that you all can feel confident in the decisions you've made as we see more and more as different states are having more issues that initially resisted these very simple ideas about math, that they're moving to that to protect their citizens. So I just want to say I appreciate what you've done.
Thank you, Ms. Dixon. And now we will conclude with Thomas Osmer. You have 3 minutes. Mr. Osmer, you're on mute. Mr. Osmer, you're on mute. Perhaps he has stepped away from his camera. And then finally, Mr. Smith, Mr. Robert Smith, why don't we go to you? And if Mr. Osmer should return, then we will afford him the 3 minutes.
Sure.
Please, Mr. Smith.
My name is Robert Smith. I'm president of an organization called the Martin Luther King Senior Men's Club. I'm leader in faith in St. Joe County. I applaud the resolution on racism that you took. It was a step forward. And also it is something that helps to bring some of the work you do into the 21st century too. I also think that that the board should make decisions on science, this especially medical science. I have two medical doctors in my family, a nurse, and I get medical advice constantly. You know, I also am a senior citizen, and I do have several underlying conditions, and I support the position on wearing masks. Thank you.
Thank you, Mr. Smith. Mr. Osmer reported in his chat, in the chat box, that he's having difficulty with his microphone. So I don't believe we're going to be able to hear public comment from him. That concludes our board meeting. We've heard from everyone. Wonderful meeting. Thank you to everyone for being here. That's where my audio would not come through. Okay. So I just wanted, if we had any concluding thoughts from the board, any. Yes, Dr. Kirsch, please.
I'd like to just thank Dr. Einters, first of all, for his strong leadership on behalf of the board. I'd like to thank him for his leadership in protecting the health of citizens of St. Joseph County and showing why we have had percentage-wise fewer coronavirus cases than some neighboring counties who have not had such strong mask ordinances put in place. I'd like to address the issue of the damage that this is doing to our financial interests in society by quoting from a July 2nd letter from the U.S. Chamber of Commerce to the United States President and Vice President. The medical evidence is clear. The wearing of masks or face coverings in public settings, especially when it is not possible to consistently maintain social distancing, is a critical element to preventing the spread of COVID-19. Regrettably, in recent weeks, we have seen evidence that in some areas where there is growing community spread, issuing voluntary guidance on masks is insufficient to protect public health. Absent stronger measures to prevent transmission, communities across America risk another round of shutdowns, broad restrictions on non-essential activities, and irreparable economic harm. To address the issue of herd immunity and people promoting COVID parties for young people. First, from a July 13th email from Chad Towner, who is the CEO and president of our own local St. Joseph Regional Medical Center, he spoke about reckless naivete. And he gave the example of NBA Utah Jazz basketball player Rudy Gobert, who was the first big professional athlete to be COVID positive back on March 11th. During an interview on June 27th, he explained how he has still not fully recovered after 108 days. This is a professional athlete with access to everything he needs for training. What can we expect for the athletic recovery of our kids? From another email on July 10th from Chad Towner from our local St. Joseph Regional Medical Center on herd immunity, the proposition that we should all try to get sick so that we can be immune. If herd immunity requires about 70% of the population to have antibodies, that would mean roughly 630,000 people just within our Michiana service area of 900,000. We are still seeing roughly 5% nationally of those with confirmed cases to require time in the ICU before either recovering or dying. That would mean 31,500 people needing one of our 25 ICU beds. Yes, this hospital can increase ICU beds to 82 if we shut down the rest of our non-COVID business, but then where will the typical non-COVID strokes, heart attacks, and fragile diabetics go for life-saving care? Or if or when we begin to see a surge, does anyone have suggestions how we begin to decide who gets those beds and ventilators? I'd like to conclude by saying that you and we all are being asked to wear a mask to protect the rest of society in case you are an asymptomatic spreader. I know that it's uncomfortable to do so. As a practicing physician, I have had to wear masks daily since this started, up to 12 hours at a time, as have countless other healthcare workers, food service workers, store employees, factory employees, etc. We do it to protect all of you. Wearing a mask for a brief shopping trip or when otherwise out in public is the least you can do to not only protect us if we are shopping with you, but also to decrease the spread of this disease for which there is no cure and which could overwhelm our local health system. Thank you.
Thank you, Dr. Kirsch. I think on that note, we will adjourn this meeting. We will see everybody next month. Have a good evening.
Good, very nice presentation.
Good job, Brett.
We need to.
Great job, Brett.
You're still on, so beware.
Sorry.